Ever encountered a patient complaining of chest discomfort? How quickly did your mind jump to angina? Angina, as many of us know, is a type of chest pain that occurs when the heart muscle doesn't get enough blood. It can feel like a vice squeezing your chest or a heavy weight resting on your heart. But what exactly causes this sensation? Well, angina is primarily a symptom of coronary artery disease. This is a condition where fatty deposits, also known as plaques, build up in the arteries that supply your heart with blood. When these arteries become narrow or blocked, the blood flow to the heart is reduced, leading to the chest pain we know as angina. It's a common condition, and yet it's often misunderstood. So whether you're a seasoned professional or a medical student, understanding angina is pivotal for every healthcare professional. Let us delve deeper into the details. Did you know angina isn't just one type, but can be classified into four? Firstly, we have stable angina, the most common type, often triggered by physical exertion or stress. It's like a predictable, unwelcome guest. We know when it's likely to show up. Then there's unstable angina, a bit of a wild card. It can occur unexpectedly, even at rest, and is a serious warning sign of a potential heart attack. Next, we have variant, or Prinzmetal's angina. This one is a bit of a rebel, caused by a spasm in a coronary artery. It typically happens when you're at rest and your heart's demand for oxygen is lower. Finally, there's microvascular angina. This one is tricky. It's caused by problems in the tiny arteries of the heart and can be more severe and longer lasting than other types. Each type of angina is unique, requiring a different approach for diagnosis and treatment. What causes angina? The etiology is more complex than you might think. At the heart of angina is a fundamental imbalance between the oxygen demand of the heart muscle and the oxygen supply it receives. The most common cause is atherosclerosis, which is the buildup of fatty plaques within the coronary arteries. These plaques narrow the arteries, restricting blood flow and oxygen supply to the heart. But atherosclerosis isn't the only culprit. Blood clot formation or thrombosis can also lead to angina. Clots can block the coronary arteries, causing a sudden decrease in blood flow to the heart. Another cause is coronary artery spasm. This is when the smooth muscles in the artery wall contract, temporarily narrowing the artery and reducing blood flow. Severe anemia can also cause angina. In anemia, there isn't enough hemoglobin in the blood to carry oxygen to the heart, resulting in oxygen deprivation. Identifying the cause is the first step towards effective treatment. Let's delve into the pathogenesis of angina. How does reduced blood flow result in chest pain? The process begins when there's a decrease in the blood supply to the heart, often due to the narrowing or blockage of the coronary arteries. This could be caused by atherosclerosis, where plaque buildup restricts blood flow. Now, the heart is a muscle that needs oxygen to function, and it gets this oxygen from the blood. When the heart's demand for oxygen exceeds the supply, due to this reduced blood flow, myocardial ischemia ensues. This is a condition where the heart muscle is starved of oxygen. And what's the body's response to this? Pain. This is the chest pain or discomfort that we call angina. It's the body's distress signal, indicating that the heart is not getting enough oxygen. So in essence, it's a sequence of events. Reduced blood flow leads to decreased oxygen supply, which in turn leads to angina. This is the process that turns a blockage into pain. How does a patient with angina present? What are the telltale signs? Let's delve into the clinical features of angina to answer these questions. A patient with angina typically experiences chest discomfort, often described as a sensation of pressure, heaviness, or squeezing. This discomfort may radiate to the arms, neck, jaw, shoulder, or back. It's crucial to understand that this discomfort is often brought on by physical exertion or emotional stress, and usually lasts less than 5 minutes. Alongside chest discomfort, shortness of breath is another significant symptom of angina. This occurs when the heart muscle isn't getting enough oxygen-rich blood, causing difficulty in breathing. Patients may feel like they've run a marathon, even if they've only climbed a flight of stairs or walked a short distance. Fatigue and weakness are also common in angina patients. The heart is working harder to pump blood around the body, which can leave patients feeling tired and weak. They may find it challenging to perform their usual daily activities due to a lack of energy or strength. However, It's important to note that symptoms can vary based on the type of angina a patient has. For instance, those with stable angina may experience predictable chest pain that occurs with exertion and subsides with rest. On the other hand, those with unstable angina may experience chest pain that is more frequent, severe and unpredictable, occurring even at rest or with minimal exertion. It may also be worth mentioning that some patients, particularly women, older adults and people with diabetes, may have atypical symptoms or even no symptoms at all. These individuals may experience symptoms like indigestion, nausea, palpitations or excessive sweating, which can often be mistaken for other conditions. Being vigilant about these symptoms can lead to early diagnosis and better patient outcomes. It's crucial to remember that any chest discomfort or unusual symptoms should be evaluated by a healthcare professional promptly. Early recognition and treatment of angina can prevent a heart attack and save lives. Having identified the clinical features of angina, how might we proceed with the examination of a patient with suspected angina? Let's delve into a clinical approach. The initial step is the comprehensive general examination. This involves a detailed observation for signs of associated conditions that might contribute to angina. These include obesity, which is assessed by calculating the body mass index, BMI, to gain an understanding of the patient's weight in relation to their height. Hypertension is another critical factor. It's important to measure blood pressure using a calibrated sphygmomanometer to detect any elevations. The presence of diabetes can be signaled by signs such as polyuria, polydipsia, or unexplained weight loss. Additionally, we document any signs of anxiety or distress which often accompany angina. This typically involves paying attention to the patient's demeanor, expression, and verbal cues. Next, we move on to the systemic examination, a crucial component in the assessment of angina. We commence with the cardiovascular examination by evaluating heart rate and rhythm through palpation of the radial pulse and auscultation of the heart. Any irregularity or increased rate may signify an augmented risk of angina. Auscultation also aids detecting any murmur, indicative of valvular heart diseases. The presence of peripheral edema or jugular venous distension could be signs of heart failure. The respiratory examination follows. We look for signs of respiratory distress, such as shortness of breath, wheezing, or other signs of respiratory distress. The use of accessory muscles of respiration, nasal flaring or intercostal retractions may hint at a lack of oxygen supply to the heart, leading to angina. The abdominal examination is a significant part of the systemic examination. Here we palpate the abdomen for signs of central obesity, indicated by a waist circumference of more than 102 centimeters in men or 88 centimeters in women, thereby acting as a significant risk factor for angina and heart disease. A meticulous examination can yield invaluable insights into the severity of angina. It aids in differentiating angina from other conditions with overlapping symptoms and provides a comprehensive understanding of the patient's overall health status. This, synergized with the clinical features and investigations, steers us in chalking out an effective treatment plan. It's pivotal to remember that a clinical examination is a crucial part of the diagnostic process and must be performed by a healthcare professional. How do we confirm if it's angina? Here's where investigations come into play. Investigations for angina are crucial in not just confirming the diagnosis, but also in determining the extent of the disease and guiding treatment strategies. Let's delve deeper into the common investigations used for diagnosing angina. First off, we have the electrocardiogram, or ECG. It's a simple and non-invasive test that records the electrical activity of the heart. During an angina attack, the ECG often shows changes suggestive of ischemia. However, the ECG may be normal in between attacks, which is why it's sometimes necessary to do a stress ECG. Stress testing is the next step. This involves monitoring the heart's activity while the patient exercises, usually on a treadmill or exercise bike. The exercise increases the demand for oxygen by the heart, and in patients with angina, this can cause symptoms and changes on the ECG. If a patient can't exercise, medications can be used to stimulate the effects of exercise on the heart. Then, We have the echocardiogram, another non-invasive test that uses sound waves to create detailed images of the heart's structure and function. It can reveal areas of the heart muscle that aren't contracting normally due to poor blood flow or previous heart attacks. Another key investigation is the coronary angiography. This is an invasive test where a dye is injected into the coronary arteries through a catheter and X-rays are taken. It's the gold standard for diagnosing coronary artery disease, as it can show the exact location and severity of any blockages. Finally, blood tests are used to check for levels of certain fats, cholesterol, sugar and proteins. An increase in certain proteins may suggest a recent heart attack. These investigations, though they may sound extensive, are critical in painting a complete picture of the patient's condition. They can provide valuable information about the degree and severity of the disease, which is essential for formulating an effective treatment plan. These investigations not only confirm the diagnosis but also help in planning the treatment strategy. Scene script. Once diagnosed, how do we manage a patient with angina? Let's delve into the mainstay of angina management. It's a three-pronged approach: lifestyle changes, medications, and potential surgical interventions. First and foremost, lifestyle changes are essential. Patients are advised to adopt a heart-healthy lifestyle. This includes regular exercise, a balanced diet low in saturated fats and cholesterol, and maintaining a healthy weight. They're also encouraged to quit smoking and limit alcohol intake. Stress management techniques can also be beneficial, as stress can trigger angina episodes. Next, we have medications, an integral part of angina management. These include nitroglycerin, which can quickly relieve angina pain by relaxing and widening blood vessels. Beta blockers and calcium channel blockers are also used to reduce the heart's workload, thus preventing angina. Additionally, antiplatelet drugs and statins may be prescribed to decrease the risk of a heart attack. Lastly, for some patients, lifestyle changes and medications may not be enough. In these cases, surgical interventions such as angioplasty or bypass surgery could be required. Angioplasty involves using a balloon to widen the blocked artery, while bypass surgery creates a new route for blood to flow around the blocked artery. So managing angina is a comprehensive process tailored to each patient's condition and needs. It's about alleviating symptoms, improving quality of life, and reducing the risk of more serious heart conditions. With the right management, patients with angina can lead a normal and healthy life. So, what have we learned about angina? We've delved into the various types of angina, its etiology and pathogenesis. We've outlined the key clinical features to look for and the investigations necessary for a conclusive diagnosis. With a clear understanding of its management, we can enhance patient outcomes. Remember, recognizing the types, understanding the cause, identifying the symptoms, conducting proper investigations, and implementing effective management strategies are paramount. With this knowledge, you are better equipped to identify and manage angina effectively, ultimately improving patient care.